A 28-year-old female comes to the emergency department. She presents with body temperature of 38.4 Celsius, 101.12 Fahrenheit, and presents with non-tolerable abdominal, flank, and back pain, and also an altered mental status. Following physical examination, a petechial rash is revealed on her trunk and limbs. The Brzezinski sign is positive. Initiated via passive neck flexion, it elicits hip and knee flexion. We can also remark a positive Kernick sign, in which a 90-degree knee flexion and a 90-degree hip flexion elicit pain or limited extension. Time is passing. She becomes hypotensive, with a systolic blood pressure of less than 90, a heart rate of 118. Fluid resuscitation is not restoring her blood pressure. The metabolic panel that was requested shows a sodium level of 121 MCQ per liter, the reference being 135 to 146, and a potassium level of 6.4 MCQ per liter, the reference being 3.5 till 5.3. A repeat physical exam shows generalized abdominal tenderness, elicited upon deep palpation. An ultrasound, quickly followed by a CT scan, yields the first clue to the possibility of adrenal insufficiency secondary to bilateral adrenal hemorrhage. Pause the video for a moment. I'm gonna let you think. What could be the most probable primary diagnosis? This particular patient has disseminated intravascular coagulation, DIC for short. It is caused by meningococcemia, as confirmed by a later lab culture, and evidenced by symptoms of shock, hyponatremia, and hyperkalemia. In a state of shock, the sympathetic nervous system is activated in an effort to compensate for the hypotension. Tachycardia and tachypnea would be observed initially. DIC can eventually lead to Waterhouse-Friderichsen syndrome, which is characterized by bilateral hemorrhagic necrosis or infarction of the adrenal cortex due to coagulopathy. In this example, Neisseria gonorrhea was the cause, but frankly, this syndrome may also be caused by sepsis via other infectious pathogens, such as Streptococcus pneumonia, Staphylococcus aureus. We can also have non-infectious causes of DIC, such as anticoagulant use, surgery, or at times even pregnancy. The resultant adrenal insufficiency is primarily associated with low mineralocorticoid levels leading to hypotension. A steep decline of cortisol would be documented. In addition to its effects on glucose homeostasis, cortisol can exhibit vasopressive effects by increasing vascular tone. Destruction of the adrenal gland would lead to decreased circulating cortisol. A feedback mechanism is initiated. High renin levels result as a reflex regulatory mechanism that tries to stimulate the gland.